Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about having reactions to herbs. Herbs are wonderful, they're lovely, they're also very strong. They're also multi-purpose, meaning that if you said to me, I really want an herb that just kills this virus or just kills that bacteria or just modulates my immune system, and I don't want it to do anything else in my body, I would say, I'm sorry, those herbs don't exist, because there are just hundreds, if not thousands, of different phytocompounds in different herbs, and you're not going to find an herb that just does one thing. For example, the herb Japanese knotweed, it helps to kill the Lyme disease bacteria. We have Petri dish studies showing that it definitely is able to do that. It's able to kill other types of microbes too, but it's also immunomodulating. It also has other properties, has anti-inflammatory properties to it, and other things as well. And so there's kind of a multitude of benefits to various herbs, and that's a great thing. It's one of the reasons I love herbs like Japanese knotweed or Chinese skullcap or the herb Hutunia or red sage or various other ones when I'm working with patients who are dealing with chronic infections, because they do so many different things, and it allows me to use one herb to try to achieve multiple different goals, so patients aren't needing to take a cacophony of multiple herbs all at once. The downside, though, is that sometimes we get effects from those herbs that are otherwise might be pushing certain systems in the body too quickly that aren't ready for that yet. A really great example of that type, or an example or a scenario that I've seen played out many times in my practice, is that we get the lymphatic system moving faster than the patient's body is able to comfortably tolerate it. So sometimes we're working with herbs and it's killing off the microbes at an appropriate pace. The patient's not having a Herx reaction, so they're not noticing an exacerbation of their fatigue, brain fog, neurological symptoms, etc. But they start getting other sort of new symptoms or out of the blue symptoms. So they might say, I'm getting itchy. I am starting to get aches or pains in body parts that I wasn't previously having issues with. My skin's starting to break out. I'm getting some eczema or some acne lesions popping up. And so those would all be signs suggesting that we might be moving the lymph too quickly. We're starting to get the lymphatic ball rolling, and the detox systems are just not ready for the release of toxins or other metabolic waste products that were maybe stuck in the tissues, and so the patient's feeling worse. So that's one scenario that can happen. Another scenario that can happen with herbs is that sometimes the issue is that they're killing things off too quickly. They're killing those microbes, viruses, whatever it happened to be, too quickly, and systems like the lymphatic system can't deal with that burden. So even though an herbal formula might be good at supporting the lymphatic system and killing the microbes, it might not be supporting the lymphatic system comprehensively enough. It's one of the reasons that I really like targeted dry skin brushing, which is something I've posted about before, because it's just a nice manual therapy to get the lymph moving, and it can just, in my opinion, in my experience, work in many cases much faster, much more directly and efficiently than internal treatments like herbs and different things like that. However, what might happen, so getting back to the original point, the herbs, if they're killing things faster than the lymphatic system can deal with them, kind of flush them out of the body, then sometimes you're going to see more of these congestion types of symptoms. You might just see a straight up Herx, absolutely, but you might also see more fluid congestion symptoms. So patients might report having more swelling in certain body parts. So they might get some swelling in their hands, or they might get edema in their feet, or they might report nasal congestion or ear congestion or things to that effect. And so when that's happening, I'm thinking we got to get the lymphatic system moving more. So sometimes the lymph is moving maybe too quickly, and we're going to see more of these detox symptoms, usually manifesting as skin symptoms. Sometimes it's a little different, but that's a common manifestation. And then sometimes we're seeing congestion symptoms, which might suggest more of we're killing things off or detoxifying things faster than the lymphatic system can actually get them out of those tissues. So those are a couple of the reasons why sometimes an herbal formula might provoke some unwanted symptoms out of the blue that aren't directly related to herxing. So I hope that information is useful. If anyone has any questions about this topic or anything else, just post in the comment section below, and I'm generally very happy to talk about whatever people are interested in hearing about.